Now I'm recording. You guys just missed my intro, that's all. Can everybody see the slide? Just nod your heads. Can you see it? Now my biggest challenge is going to be seeing everybody's face on here. Do I see everybody's face on here? I don't. And I don't know how to see all of my kids' faces at one time. So you might see me go in and out of screen share if I ask a question so I can see kids' response, okay? So I'm going to give a little COVID-19 update, and I'll start by saying, what is it? What is COVID-19? So simply put, COVID-19 is a virus that belongs in the family of the coronavirus family. And it's nothing new, even though we've heard so much about it since about March, because this family of viruses causes the common cold. Who's had a cold before? Everybody knows what it feels like to have a cold. That's typically what a coronavirus does. But what's different about this one is they call it a novel virus. And novel means that it's new. So it's a new strain. It's a strain that has never infected human beings before, but this time it has. And if you look at it, it stands for coronavirus disease 19, because 19 is the year that we discovered it, but is the year that it happened. So that's why we call it COVID-19. It originated in Wuhan, China, and they traced it all the way back, and they realized it probably started at a food market there. And if you've heard some news and something about it, they'll tell you that it came from this animal. Does anybody know what this animal is? You can unmute and answer if you know. Okay, so this animal over here is called a pangolin, and it kind of is like an anteater. And this is what everybody was talking about. This is where this virus started from this animal, and then human beings got infected from this animal. However, these days, as more research came out, most scientists believe that it came from a bat. Because when they looked at the genetics or the genes in the bat COVID-19 and the human COVID-19, about 96 or 97% was exactly the same. And that's what helps us know that it probably got into humans from a bat. Now, sometimes you'll hear the name coronavirus, and corona means crown. And if you see this picture here, can you see my cursor? Yeah. See how it looks like a halo or a crown around the virus? So that's how it got its name, coronavirus, because this is under a special magnification microscope called electron microscope. And this is the kind of picture that it takes. And you can see how it glows like a halo or a crown around it. That's how it got its name. So this is a very busy looking slide and looks a little intimidating, but just follow along with me, because I want to show you what does this virus do to our bodies, because then you'll understand why they ask us to do certain things to protect ourselves from it. So I'm going to get my little pen here. And this is the coronavirus. And do you remember the yellow part that lit up? That's this blue part right here. And what it does is this whole pink thing on the bottom is our body's cell. And it comes in and it does a very sneaky thing. See right here? It presents or shows one of its little pompons on the end. It's a protein, and it fits our cell receptors like a lock and key. And it tricks our body into saying, hey, I belong here. And it tricks the body, and then the body, because it looked like a key that fit into itself, it lets it inside the cell. From inside the cell, it does another sneaky thing. You see this green squiggly line that looks like spaghetti? This is RNA. This is the genetic material of the virus. And what it tricks the body into doing is it uses the body's own they call it a ribosome, but basically what it does is there's a code written on this green spaghetti, it's RNA, and it makes the body, forces it into reading it and making all these extra little copies of itself. Do you see that? And so from one copy, it's quickly become 5 or 6 copies. And then it repackages itself in its original protein packaging. It puts its genetic material inside, and then it ships it back out of the cell. So now when you had just one virus, now you have 1, 2, 3, 4. It has multiple copies, and it's literally tricked your body into copying itself and releasing it into your body even more. Now, what happens when that happens? When those extra copies take over our body? That's when we start showing the symptoms of getting sick from the virus. So here are the 5 common symptoms of COVID-19. I think we've heard a lot of these, right? There's fever. So any temperature, we say usually over 100.4 is a fever. It'll make you cough. It'll make you get sometimes short of breath and then even chest pain or pressure. It can cause a sore throat, and it can cause a headache. So if you've been to the doctor lately, you know, we're always asking you these questions because we want to know if possibly you could be sick from COVID. So these are the very common symptoms of this infection, but lately, as we've studied it more, we're starting to learn there's some unusual symptoms. Whoops, there we go. So one of the unusual symptoms is this first picture here. You see how this person is holding their shoulders? It causes muscle aches. And one thing I've seen as a doctor is that out of all the muscle aches, back pain is very common. So if your back hurts. So you see this picture here? This person looks really cold, right? And this person's shivering. Well, it can cause chills and shakes in your body like you're cold, but you actually are not cold and you don't have a fever. Everybody knows what this picture is. So it can make you feel sick to your stomach. It can make you have nausea, can make you throw up, it can make you have diarrhea or the runs. I know it's kind of a funny word, but that can happen. And actually what we've noticed is that compared to adults, kids present more with these stomach type symptoms than adults do. Another thing that's kind of unusual is that you see how he looks like at his food? He has lost all his appetite. So you lose your sense of smell and you can lose your sense of taste, and it makes you lose your appetite and not want to eat. This is another unusual, but we're seeing it more and more, this symptom. And then lastly, you see this kid here? He's not bored. This kid is super tired. It can cause unusual tiredness, or what we doctors call fatigue. Does anybody have questions about some of these symptoms? I'll take a little minute to take questions if anybody wants to ask questions. Anyone? Okay.
Wait, I have a question.
Oh, yes.
Typically, when they have the temperature, is there a certain range that they've been seeing?
So it's actually not a very high fever. So we consider anything over 100.4 to be a fever. However, having said that, it's interesting that in some cases, up to 30 to 50% of people who have infection actually don't even have fever. So it's a common symptom, but it's not universal, and it varies from person to person. And in children, they can have fever, but it's not very high. It's more along that 100, 101 lower range. But thank you for asking the question. So I wanted to show you something that you may not get to see before, and this is something called a chest x-ray. Has anybody ever had to take an x-ray? Like you broke a bone or like you got hurt, right? This is an x-ray of the chest. And I just show this because this is what it looks like when you get serious illness. So we hear all these reports of people, you know, being in the hospital and even passing away from this illness. And in kids, it's not common. It's very, very uncommon. But I just wanted to show you why the country is taking it so seriously, why they are closing your schools, because especially the elderly and people who already have other illnesses, they can get very sick like this. So if you look at this picture of a chest x-ray, I'll show you what it is. You see these little lines here? These are your collarbones. That's right here on your neck. And then these lines over here, these are your rib bones. You see those white? Siri is trying to talk to me. Hold on. Sorry. This big balloon-looking blob in the middle is actually your heart. And then all these black spaces is actually your lungs. It's filled with air and it looks black. And if you can see here where I'm pointing, can you see? These little cloudy white patches, that is the beginning of pneumonia and lung disease in somebody with COVID. And then when they get very, very, very serious over here, you can see a lot of that black is gone and it's filled with all of these white things, which is fluid and cells and pneumonia. And even if you look over here in this triangle, I'm going to show it to you. You see this little triangle looking thing here? That's actually a part of your lower lung that's collapsed. That's what it looks like on x-ray. And this is why people can't breathe and they have to go on a ventilator sometimes. And then because their lungs start to not work, the rest of their bodies and their other organs that are important, like their heart and their liver and their kidneys, starts to shut down. And that's how people get really, really sick and even possibly pass away from COVID. So having said that, you guys don't have to worry. As children, your infection rate is very, very low. And the best way I can kind of try to explain it is in a picture. So worldwide, the amount of COVID in pediatric kids, which means kids under 18, is only 2%, okay? So that means if you look at this picture here, this is a picture of 100 people. So you randomly take 100 people from all over the world, people who are under 18 years old, and this one, the answer is 2%. So if I color in this person red, because they didn't color this one, 2 people out of every 100 kids will get COVID worldwide, okay? So that kind of puts it in perspective, like it happens, but it's not very common in children. Now in the US, for some reason, with the best data we could find, the number was slightly closer to 3.5%, which means I would have to color in another extra person. So another extra child. So 3 out of every 100 children can get coronavirus, COVID-19. So that doesn't seem that bad. What about kids who get really sick, like need to be hospitalized from coronavirus? That one is only 2 in 100,000 kids. It's a very, very, very low number. So if you go back to this picture and you multiply these number of people by 100, even then you would only have 2 people out of the 100,000 people, kids who actually have to be hospitalized for COVID. Now they did something and they looked at all the kids in the world who had to get hospitalized. It's not many, a couple hundred, but they looked at all the kids who got hospitalized coronavirus. And they looked at what kind of things about them made it special that they got really sick and other kids didn't. Those are called risk factors. And these are the things they, possibly people thought could make them have to get seriously sick from corona. How many of you think if you have asthma or lung problems that you will be at a big risk to get very sick from coronavirus? Just raise your hand if you think that's the right answer. How about how many of you think if it's a heart problem that will make you get very, very sick if a kid has a heart problem? Could be, right? Or how about a very poor immune system, like a child who has cancer? Like they can't fight the infection. Yeah, I see a couple good hands there, and that's a really good guess. Well, this is what the actual data showed, and I want to show it to you in a graph. It looks busy, but I'm going to just show you a few things. Look at the bars that have the highest, here, let me see if I can move this, there we go. Look at the bars that have the highest number. You see which 2? You see right here, and you see right here. So one of the highest reasons, if you look on my screen, it says no known condition. So that's interesting, right? So there's nothing any kid did to get sick. Out of 45% of those kids who got sick, really, they don't know why. They were pretty much previously healthy. That was 45%. But look at this one, guys. Look at the next highest one, 44%. The risk factor was obesity. Who knows what obesity means? Anybody want to answer? What does obesity mean? It basically means you're really overweight, right? So believe it or not, kids, I know some of us are laughing. We're like, oh, it means somebody's kind of fat. But this was a big risk factor for kids who got seriously sick with COVID. And this surprised me even as a pediatrician doctor. I would have thought for sure immune problems, lung problems like asthma. But when I saw this, it made me become very aware of how much I want to teach my kids and my patients that being very overweight is like a health problem. It's a real health problem. It's not just about not looking good or not feeling good, but it can put you at risk, not just for getting really sick with coronavirus, but it puts you at a risk for other things and other diseases. So I wanted my patients to really know that. And then beyond that, then we saw the next one was asthma. So those were the top 3 risk factors. Nothing that we know of, being very, very overweight, or having asthma kind of put us at a higher risk. Okay, so now that we know that, the question is, what can we do about it? What to know about how to protect yourself. And I know that you're very familiar with some of these answers because we are taught this from our parents and from schools and from other doctors and the news and announcements. But one of the 3 ways this virus gets us sick and enters our body, remember that first picture I showed you, how it tries to present the key to come into our body, into our cells, is that it actually enters through our nose, our eyes, and our mouth. And so if somebody coughs into the air or coughs on you and they're sick, and those droplets land on you, land on your eye, nose, or your mouth, it can get you infected. And that's why we say it's very important. You heard the term social distancing. Stand 6 feet away from each other. It's if you stand that far enough, it's very unlikely that if somebody even did cough, it will reach you. That's why they also tell you to stay at home and not go out and be around a lot of other people. Even though it might be frustrating and hard, that's the reasoning behind that. Also, they tell you to wash your hands for at least 20 seconds with soap and water. And that's because if you touch something that somebody with coronavirus touched, and you touch it and you touch your face with it, then it will enter your body. So if you're washing your hands often, it takes 20 seconds to kill the virus on your hands, then you're gonna be protected. Also, if you don't have that, they say you can use hand sanitizer, and as much as you can, don't touch your face, don't touch your mouth, don't touch your nose. And then how do we protect others? This is why we ask people to wear masks at the grocery store or if you go out. Because some of us, even if we're not sick and have symptoms, we can have the infection and pass it to others. So they're telling you to wear a mask because if you wear a mask and you cough or breathe into the air or sneeze, the mask will capture all of those viruses and your saliva and the droplets so it doesn't go to someone else. So you're actually helping somebody else not get sick. And then also it says disinfect surfaces that you touch often. What are some surfaces that you touch often? You guys can unmute and answer. What are some surfaces that you would consider that you touch often?
My desk.
A desk? Was it a desk?
Yeah, my desk.
Your desk, yes.
My computer.
And what?
My computer.
Yeah, like especially the keyboard, right? Because you're touching that all the time. Anybody else?
My iPad.
Your iPad, that's right. Like your phone or your iPad or surfaces you touch a lot. What else?
Doorknobs.
Doorknobs, very good. So anything else you can think of that you touch a lot? Those are some really good suggestions. Thank you for answering, guys. Yeah, those are some of them. How about faucets in our bathroom or on our sink? You can really help your parents by, you know, helping them keep those surfaces clean. You can spray it and wipe it up and then wash your hands after. And that helps everybody in the house be protected and be healthy. Whoops, I'm going backwards. What else can we do? Okay, so those are some things we've heard a lot about. Social distancing, wear a mask, clean surfaces, all that we've heard. But there's something else I want to tell you about that you can really protect yourself that maybe you didn't think of. How about good nutrition? How about our food, like vitamins? So there are special vitamins that really help our immune system. One of them is vitamin A. Out of these foods, anybody want to guess which one has a lot of vitamin A? Does anybody know? Nobody wants to guess? Okay, I'm going to tell you. So carrots have a lot of vitamin A, okay? Vitamin A is really important. It's a fat-soluble vitamin that really helps our immune system. How about vitamin D? Who knows which food of here is vitamin D? Anybody want to guess? It goes with calcium. What has a lot of calcium and vitamin D together?
Milk.
Yes, very good.
Milk.
Milk has a lot of vitamin D. And I want to go on my, I call it my soapbox. And I want to talk about vitamin D a little bit. And here's why vitamin D is so important. Not only does it help our immune system, which is very important, but I know a lot of us Koreans and Asians, we want to be tall. It also helps you grow and have strong bones and teeth. That's very important. But also, do you know that kids who are low in vitamin D have depression? Not just kids, but even adults who are vitamin D deficient, their mood is very low and they're sad. So in these times when a lot of sad things are going on, you will want to have a lot of good vitamin D, not just for your immune system, but for your mood and how you feel. So kids your age, elementary age and above, you need 3 to 4 cups or servings of dairy a day. Can I see it by hands? Who drinks that much milk every day? Probably, even I don't, I have to say, even though I know the right information. Okay, so you don't have to feel bad, but I need you guys to really start drinking milk. If you don't like milk, cheese, if you don't like cheese, yogurt, and if you can't get it through that, then you'll have to take a separate vitamin with vitamin D in it because it's very important for you. Now, how about vitamin E? So 2 are left out. So which one of these do you think has a lot of vitamin E? I'm pointing to it right here. This is a green leafy vegetable. So green leafy vegetables, this is like cabbage or bok choy or something, has a lot of vitamin E. Vitamin E or tocopherol is very important to us because it is, what it means is that it absorbs anything in our body called a free radical. And free radicals cause damage and inflammation in our body. So vitamin E is very important in our immune system for keeping us healthy. And also you hear about this one the most, vitamin C. Which one's vitamin C? Oh, there's only one left. So citrus fruit like oranges have a lot of vitamin C. Vitamin C is an immune system booster, and your body, your cells need vitamin C to just do the regular functions it needs every day to function and also repair itself. So nutrition, so basically what kind of foods are in here? Fruits, vegetables, dairy. So if you're not eating a lot of those kind of foods, you need to eat that to make yourself have a good immune system to be protected from infection. Well, how about this thing over here? Anybody take this or look familiar? Does your parents make you take this, airborne? Yeah, some of you, yeah. This is something like this is also very helpful because this has a lot of vitamin C in it, but it also has things like zinc. Remember that picture I showed you where the virus goes inside your cell and it starts to make copies of itself? Zinc has been found to make the virus not be able to make copies. So it can't make copies and infect your body more. So that's why zinc is so important. And it's good for really any virus, like a regular common cold or the flu, including the coronavirus, because it's in the family of cold viruses. So things like this do help. So don't give your parents such a hard time if they tell you to take it, okay? Okay. And then what's this guy doing right here? He looks like a serious athlete. He's exercising, right? He's running. And exercise also protects you from getting sick because it boosts your immune system. And this is why probably, again, your parents might tell you, hey, did you go outside today? Did you walk for 30 minutes? You know, they're asking you to do these things because your parents know that it actually helps your immune system. And like we talked about, it helps your mood too. And lastly, for my teenagers, good sleep is so important for your immune system. So a lot of us, we don't have school or we do school online, so we like to stay up late. But good sleep is so important. Number one, good sleep is when you grow, and good sleep is the time that your body needs to repair all the damage to itself that happened during the day. So if you don't get enough sleep, you'll feel tired. Not only if you feel tired, but your body will not be able to fight infection. Like, it's not going to be strong enough to do what it's meant to do. Okay? So those are some other really good things to keep in mind while you're trying to stay healthy, not just from coronavirus, but in general. So I want to talk to you a little bit about being happy and healthy. That's what I call our mental, which is our mind and our thoughts, and our emotional health, which is our feelings and our emotions, okay? It's how to be happy and healthy too. How do we do that? Well, the first thing is to review everything that I put on the previous slide. Because when your body feels good and your body gets the nutrients it needs and your body gets the rest it needs and the exercise it needs, your emotions and your mind naturally work better and feel better. So don't forget everything on that previous slide. But there is a bunch of studies that looked at what helps people and kids feel happy, even in these stressful times. And it was saying that you need to be staying connected. So if somebody's building a house, you need a good foundation, right? So having good connections and relationships during this time is what gives you a solid foundation for feeling good. And it's not just like scrolling through Facebook or Instagram. It's not just observing and reading and watching videos or funny videos that really help. It's the depth and the quality of your relationships that have been proven to help kids feel better. So you see this picture here, I purposely picked it because this person, this child, is talking to an old Haimani, and they're also talking to maybe like a young Imo or Kumo or an aunt, okay? Because just talking to your friends it is good. Staying connected with your friends is good. But when you talk to people who are older than you, different age than you start to learn and get different perspectives and get a different point of view about things. And all of that help you to think about something bigger from a bigger perspective, and that also helps us feel better. So it's not just, like I said, watching things or being on TV or watching a screen. It's really important to share things deeply, like how you're feeling, how your day was, what's making you sad, what made you happy that day. Sharing those things with people frequently and being connected, whether it's through the phone or the video or Zoom or things like this, that has actually been proven to help kids be happier mentally and emotionally. There's another one here, and another study showed that kids who stay on a schedule or a routine actually feel better and do better. And what I mean by a routine is, I don't mean like you have to be like 7 o'clock. I have to do this. 7:05, I have to brush my teeth. 7:15, I have to do this. I don't mean like you have to do it exactly on a schedule on a clock, but it's a routine. Like it's a pattern of things that we do. So you get up, then you should do something similar. And then after you get dressed, you brush your teeth. After you brush your teeth, you eat breakfast. After your breakfast, you help clean up. And then, after that, I'm going to do a little bit of homework or on the screen. Then I'm going to take a break and go for a walk. People who do the same routine every day generally feel better in their mind and in their emotions. And the reason why that is because when your body gets used to a routine, it starts to expect what's next. And when your body knows what to expect, what's coming next, your body actually feels less stress and less anxiety. And so, again, you might feel like, oh, why is my parents telling me to do this and follow a schedule or a routine? But really, it actually helps your mood and helps you feel better, okay? And I promise, none of your parents called me before this talk and said, can you tell them these things so that they listen to me better? This is all stuff that's proven in science, okay? So they didn't pay me money. They didn't ask me to say this stuff, okay? But this is just what science has proven. Lastly, having a happy and healthy mind and emotion has to do with having a great attitude or gratitude, okay? Gratitude is the quality of being thankful, readiness to show appreciation, and returning kindness. And I know it sounds kind of cheesy maybe, but it's actually been shown for our mental and emotional well-being that when you do something to say thank you or encourage someone else, not only does it make them feel better or feel valued, but you in turn feel good about it. So it might be something as small as, writing a letter of thank you to a teacher or to an essential worker, or sending a note to encourage a friend, or mailing them a letter, or sending them an email. I know a lot of people were making masks to help out. All of these activities, when people did them, it showed that they actually themselves had better mental and emotional well-being. So I'm going to encourage you guys to do that every once in a while, to think of something that can encourage others and say thank you to others and see how that makes you feel, okay? It doesn't have to be super big, super heroic. It's the little things that make us feel better. And that's pretty much my presentation. I really, thank you. I see people clapping, thank you. I wanna give you guys a chance to ask any questions or even maybe a short comment. And I am more than willing, and please don't be shy, because everybody's probably thinking the same thing or have a similar question.
I have a question.
Sure, I'll see if I can answer it. I'll try my best.
Do you know what time the quarantine will be over by, or like, when will it be over?
That is a good question. We don't know. The quarantine is already, there's different phases to opening up. So I know you've probably heard about the different phases. And in the country, depending on how many cases of people who are sick, they're determining if it's safe enough to do more and more things, okay? And so that's why even when people are opening up, it doesn't look like how life was before. Like your local pool might open up, and your local, this might open up, and eventually your school will open up, but it's not going to look like it did before because of the things that I talked about with how this infection spreads and what we need to do to protect ourselves. So even if restaurants are open, they're going to set the tables farther apart and less people can be in a room at a time. And they are making safe measures so that we can let things start to open, but still keep it safe. But I don't know, and I'm not a politician, so I have no power in when it opens up. But I hope the information I gave you when things start to open up more and more will help you know how to keep yourself safe.
Okay, thank you.
Thanks for the question. Good question. Anybody else? No, nobody else. I'm gonna just hang on one more minute to let other people ask in case they're being super shy.
How much zinc does zinc should kids take?
That is a really good question. So adults, I know off the top of my head, to have really good effects should take 50 milligrams a day or less, no more. Because unlike certain vitamins like vitamin C, you can take a ton of it. And if you eat too much, your body can get rid of it in the through your urine and through your body. But things like zinc, actually taken too much, can actually be harmful. So somewhere, and everybody disagrees, between about 30 to 50 milligrams for an adult. So depending on your age and how big you are based on that, the typical, like the airborne and the zinc that's in there averages around 10 milligrams a day. So I would say for my kids, about 10 milligrams a day is good. But if you're more like 12 and older, like an adult size, then you can probably take more than that, like 20, 30, and that will help.
Would you suggest that airborne be the best supplement to take, or is there any other way to?
You know, that's a good question, because I have actually stood at the grocery store and looked at all of these different airbornes, and what's really surprising is that some of them are labeled airborne, but they have very little zinc, and some of them have very high zinc. So whether it's airborne, emergency, coldies, or any of those products, you want to really read the label to find one that has at least like 10 or 20 milligrams to do something. And they do sell zinc separately, not in there. So just for me personally, especially before I go to work, on those days I took 50 milligrams of zinc and I took 1,000 milligrams of vitamin C before I went. And that I did that. Now, you shouldn't take that 50 milligrams every day for weeks and weeks on end. But if I knew that I was going into work, that's what I did. But about 10, 20 is good for a day. So just read the labels carefully, okay? Which ones have it? Which one does Tina have? Yeah, which one do you have? Emergency?
I have airborne original with the blast of vitamin C, and for zinc, it's 8 milligrams.
So
I have 2 different flavors, and it's all 8 milligrams.
yeah. So some of them have 10, some of them have 12. And so take one, like, does it say one twice a day? Once to twice a day?
It says, let me see. Yes, 1 tablet. But it does say repeat every 3 to 4 hours as necessary.
Right. So when you're just trying to prevent it, you have it once a day. When you're actively sick with a cold, you take it 3 to 4 times a day. And that's how you get your 30, 40 milligrams, not to exceed 50 milligrams a day. I hope that helped answer that question, Jimmy. Is he still there? Not sure if he's still on, but hopefully that.
Yes, it did. We were on mute. I guess you can't see us.
Sorry, yeah, I have so many people on the screen, I can't see them all at once. Awesome. Any other questions? Okay. All right, guys. I want to thank you so much for joining me. You know, I really enjoy this. I enjoyed this a lot more than last week when I talked to the mommies and daddies. Because I just love talking to kids and helping you guys learn something. So I hope everybody learned something today at least. And I hope you guys stay happy, healthy, remember all those things.
Yep.
And yeah, next week I'm going to be talking mainly to the parents about things that COVID causes that's not directly the illness itself. So I'm going to talk a little bit about how it has impacted people's mood, different public health issues that I think it's important for us to be aware of. Because, you know, we only think about the illness and the deaths and all of those statistics, but there's many other things that have impacted us as a society. So hopefully you guys will join me for that. And yeah, thank you and have a really great night.
Bye.
Bye.
Thank you.
Nice to meet you.
Thank you. Thanks for joining.